Hi everyone, this is Marcus Simpson with Surgery Pro, here to talk with you today about the digital script and workflow for the Kneehab XP quadriceps treatment system or muscle disuse, muscle atrophy treatment system. So this is the device right here, and there are also a couple of other visual components for shoulder and then additional knee approaches. There's also a lumbar spine device, which is not imaged, but we could go over with you. Now, this is a sort of a legally enforceable digital script that enables digital signature and digital submission. You can also print it out. You can fax it. You can save it. You can do a lot of interesting, cool things. And I'm going to kind of walk you through some of the functionality. Now, I have a longer video on sort of the full-on workflow of these kinds of files. That is the DVT Pro video. So if you can find that video, these are unlisted on YouTube, or you can email me and I'll send you the link. But that video is a little bit longer and goes into a little bit more of the background. There's another video, by the way, on digital scripting and legalities and digital signature and so forth. So if you're curious therein, but I'll try and keep this a little bit shorter. So first of all is that these are all functional fields. Okay, I've clicked in the first name, and then all I'm doing is tabbing between fields. So I can again go back to the first field, and I can put my name in here if I want. My date of birth. Not that old, but fortunately not getting there fast. I can type in, phone number, yada, 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 cell phone, surgery or injury date, primary insurance, secondary insurance, spouse name and date of birth if my spouse were my primary insurance holder, email if the patient is given you permission to use that. We'll, of course, confirm that they're open to receiving therein as well. Duration of need, typical duration of need on this would be 3 to 6 months. Prescribe it longer if you want to be on the safe side. So otherwise, we're going to have to come back to you for extensions. 99 is lifetime. Now, nothing is selected here, so note that you've got to select either left quad, right quad, bilateral, which would basically be one controller and 2 garments. I've got a left shoulder, right shoulder, bilateral shoulder, and spine. And again, I can click. Okay, so click to select, click to deselect, or I can use my tab key. Okay, so I've tabbed over to say maybe I'm going to do the right quad, and I'm just using the spacebar now to select that right quad. Tab to forward, up, and you know what? It wasn't the right. I'm using Shift Tab, and now I can select the left quad and deselect with the spacebar the right quad. So again, tab to move down, Shift Tab to move up, spacebar to select a checkbox, and then of course I can type. Now, I need to indicate the treatment sessions. Usually it would be 3 sessions per day at 20 minutes or 30 minutes, 25 minutes. Your call. You can also put in something here to say, 3 by 20 minute standard, or as directed by PT. You could just list your normal treatment approach here. Any additional instructions we need to know, you would enter there. You have this much space, so not a ton, but hopefully enough. This primary ICD-9 is required. You may have a secondary as well, perhaps. And again, I can just select, or I can put in my own. This is the CMN block, which describes the sort of the medical efficacy and rules therein. Provider facility, I would put in my information. I've got checkboxes here, so if I have a series of providers, and I'll talk with you before the end of the video about setting that up, but I fill out my information. Again, I'm tabbing through, entering, and then finally I've got a signature field, I've got a clear field, a print field, and a submit field, and then a couple of additional providers. So working sort of backwards, when I click the signature field, I have, this is my digital signature, but I can have a drop-down list here, okay, of different digital signatures, and I can label them appropriately. That would allow me to have all of my doctors that might prescribe this set up electronically, and as long as I have their permission and or it's their signature and I'm acting on their behalf, then I can assign that Dr. Smith has prescribed this, and obviously that's part of his protocol. That's doable. Or if I'm the doctor and I have this in my laptop, no problem. Clear button, just so you know, clears the file back to its native state. The print button will pull up the print dialog box, and I can select which printer I would like, and then print that out. I can also, of course, save the file. Now I'm going to escape out of full screen mode here so you can see, and then just remember that in a normal workflow, that's a photo I took of New York City. It's pretty cool, actually. Isn't that nice? All right. So in a normal workflow, I can save this as. Remember, if I click save, I've overwritten the file. But if I click save as, I can save it with a new name, and I might call it, Simpson, Marcus, Kneehab. Or maybe the date. Maybe I'm not comfortable using the name. I'd use some sort of code or something like this. That works, whatever my workflow is. And now I've got a saved version of the script, which I can then attach to my EMR. I'm going to go back to full screen mode. I want you to know this, that there's a bunch of different ways that you can view this file in Adobe Reader or Adobe Professional. I do want you to know that this file will not work particularly well if you don't have the current version of Adobe Reader. You're going to want to have that, and it's free. You just go to adobe.com and download the current version of, again, Adobe Reader 11. Mac Preview will not work. That's the default PDF editor on Mac, will not work. So just know that you'll need to have the current version of Adobe Reader 11. Now, back to, we've just gone over print. Now, if I, just before I go on to the submit button, perhaps I have taken this form from its original state, and I want to have my doctors pre-completed here. I'll enter my doctor information. Okay, maybe I have 4 doctors that might prescribe this device. I enter my facility information, and then I save that file as my master template. Okay, so I might even rename it as my group Kneehab Master. And then it could even create a backup thereof. I have 2 of those files. And then every time I enter a new patient's data, I will simply title it separately. So I'll do a save as, title it unique to the patient, and then I haven't overwritten the original file. So that enables me sort of a shortcut. Now, another thing that we can do is you can contact our group, Surgery Pro. We'll enter the doctor's information, and then we can lock these fields so that the basic provider fields are not editable, so you don't have to worry about it, and you just clear the file, save it as the patient's name, good to go. Submit. If you have a HIPAA secure email, you can submit this file electronically. Really cool. With a digital signature, never have to print the thing. Just add it, attach it to your EMR, you're good to go. Now, what does this really mean? Well, I can't use webmail unless I have a specific, none of these are acceptable. So I would have to have a secure webmail. Otherwise, I would need to use my mail program, for example, Outlook, but the Outlook program or the host has to be HIPAA secure. Now, our system is, and what we can do is we can help you set that up because of this really cool thing right here. We're building a system. We are building a company called @Medicine, which will be an email system under this domain. So you can. We'll be launching this in the next month or 2, but the idea is that we're building domain names for physician groups. So, for example, if you already have South Shore Ortho, you can actually have a secure email system through this engine with an @medicine.org email address or your @southshoreortho.com. But we can create that so that your surgical scheduler does have a full-on HIPAA secure email system that he or she can use for us and any other company wherein you need to do secure email transmission. And so a little bit more on that. It's a little bit of a complicated topic, but awesome to invest in if you'd like to save yourself time. And remember, time is money. The more that we can do this digitally, the better. So that's the form. Still 9 minutes long, but hopefully that covered some of the info for you. And feel free to contact us at this email, providersupport@surgerypro.com. You can email me at Marcus, Marcus, at surgerypro.com. Thanks so much for working with us, and we really appreciate your time and support. And hope this work for you and your patients. Do send us feedback and let us know what we can change to improve it. Thanks.